Does anyone with more experience with Zoom have any helpful hints? I apologize. We don't use Zoom very often.
Stephanie, how long will this availability be? 30 minutes?
It will be about 30 minutes, yes.
Thank you.
Specialist Silhavy, why don't you, if you could go ahead and mute here for a second.
Stephanie, Dan Tierney is on. Maybe he can help.
Hi, Stephanie, what's the issue?
Hey, Dan, we are not used to Zoom, and folks are saying that they don't have the ability to start recording off of this. Do you know if there's a magic button that we need to push on our end?
You should record on your end, and then after you start that, you should press, for everybody who's requested it, on their picture or next to their name, there's either the three dots in the top right corner or the more button next to their name. And that's where you can give them each individual access to record on their end to their files. I think it's easiest just to go Hollywood Square style and use the three dots in the top right corner where they are located.
Hold on, Dan. Let me double check. Under view. You want to go ahead.
Recording in progress.
I'm going to just, yeah, we were able to get that recording, Stephanie. Thank you. And Dan.
Merry Christmas, Luann.
Good afternoon. I'm Major General John Harris. I'm the Adjutant General here in Ohio and also the Commanding General of the Ohio National Guard. As most Ohioans are aware by now, Governor DeWine recently ordered the National Guard into hospitals throughout the state of Ohio. Those hospitals are strained due to the coronavirus and what we're calling a perfect storm, where they're experiencing shortfalls in staffing, as well as a pretty significant surge in patients due to COVID-19. Our soldiers and airmen will be deployed to the facilities that will be determined by the Ohio Department of Health, and they will set the priorities for where our soldiers and airmen will go. We'll provide medical support in those facilities, as well as what we're calling wraparound services. So anything really to help them increase their capacity to deal with COVID-19 patients.
So is there someone in your family who's a total boost bag?
Well, we're talking candidate.
With that, I'll take questions.
Hold on. Luann Stoya from Channel 6, sir.
Hi, Luann.
Good afternoon, General. Good to see you. I would like to hear from you about getting your National Guard members out into these facilities during the holidays. You know, how difficult is that for them, leaving family, friends at this time of year? And is that also part of the challenge that you're trying to meet with hospitals maybe finding themselves short on help during the holidays?
Well, the challenge is more of it's more of the gut challenge for the leaders who have to call these folks during the holidays. I can tell you that just about all the soldiers and airmen that we called to report showed up. And I personally went down yesterday during their end processing and talked to all of them and explained to them how dire the crisis is in some of the hospitals. And they certainly understand that, and that this crisis is really no different than the last time that we deployed. It's just very unfortunate that we're doing this during the holidays. But our leaders are empowered to take a people first approach. And literally, we're looking at every single person that's called to duty. And we want to make sure that we still don't miss any major life events. We don't want anybody missing births of children or that sort of thing for this kind of event. So we're looking very carefully, not only at that, but also at their profession. If we're degrading the ability of someone else to provide COVID care or to respond here, first responders, sheriff's deputies, that sort of thing, then we're looking at those at a case-by-case basis and making sure we exempt them from the mission. It's tough to build these numbers. It seems like the National Guard 16, 17,000 is a large number, but you know, we're only bringing on people who are vaccinated, fully vaccinated, because we certainly don't want to cause any harm. And so all those factors go together, but I can tell you, I couldn't be more proud of our guardsmen. These soldiers and airmen have shown up. Their morale has been high, and they know they're helping the community. That's the important thing. You make the case to soldiers and airmen that they're helping the community, they will be there, and these have. And I will tell you that I think the morale is going to stay pretty high because they're helping, and they get it. And you tell soldiers and airmen, you give them a task, you tell them purpose why they're doing it, and they'll move out. And our folks have certainly done that.
Major General Jordan Vandenberg from News 5 in Cleveland. Appreciate your time. There was a big testing clinic, testing site in Cleveland this morning. Line was cut off after 3 hours, and there was some traffic issues, I guess they're putting it lightly. How would you assess the effectiveness of that site, and has there been any consideration to moving it to a possible different location? Thank you.
Yeah, thanks for the question. That site is a great example of exactly what we're trying to accomplish here. In that case, so many people were going to the emergency department for nothing other than COVID testing that they asked us to see what we could do to relieve some of that pressure on the emergency department. So we established that site. It's a joint site between Cleveland Clinic, University Hospitals, and some other hospital systems there in the Cleveland area. So it's a joint endeavor, but the idea was to move that testing and move that patient load away from the emergency department and move it into that drive-through site. And that the fact that it was so overwhelmed so quickly, I think, is just a great indication of how extreme the situation is for the hospital there. So it was it was shut off, cut down. The line was cut down after 3 hours because it was disrupting traffic. So we've got to relook the operations there. The intent's to keep going because there's clearly a need, but we just have to put our operations folks on and figure out in conjunction with those hospitals how we can manage traffic flow, not create impediments for the community there. But the need for testing still exists, and we're going to find a way to get it done without impeding the folks who are trying to get to work there downtown.
Hi, and thank you. And just a reminder, folks, I will call on you. So if you would please hold until we call you. Clay Gordon with Channel 10, please.
General Harris, thanks for your time today. You mentioned some of the guardsmen being deployed, some more medically highly trained, other more wraparound services. For the highly medically trained guardsmen, where are they coming from, and what hospitals do you think are the most trained and they'll be going to?
Well, the specific hospitals, I couldn't tell you that. We're working with Department of Health and who's also working with the Hospital Association to get the best data that they can. And it's going to be fluid. We know, especially as Omicron increases and moves around the state, we're building agility so that we can shift based on where the most demand is. But those medical folks are going to do what they can. Each hospital and health system is trying to increase capacity at bed space. And in order to do that, bed space is really two parts. We typically think of a bed, but it's really the bed and the staffing for the beds. So we're doing whatever we can at the request of the hospitals to roll in and to be able to help them staff those beds so they can increase their COVID capacity, because the challenge that they have is that it's maintaining standards of care, not just for their COVID patients, but for everyone else. Because you have ICUs that are filled. You've got patients that are waiting in emergency departments for up to 3 days to get a bed. And that certainly doesn't bode well for medical outcomes for those folks. So we're trying to create that COVID specific capacity any way we can and help them with staffing those beds so that they can have more beds in the hospital available for other things. And some of the larger hospitals may be able to create some relief for smaller hospitals to move patients in and create some space in those smaller hospitals also. So ODH, the Department of Health, develops a strategy and tells us where to target them, and we'll move our teams around as necessary to meet that demand. And at the request of the hospitals to...
Spencer Hickey with Hannah News.
Thank you. Could you talk more about the specific timetable for when people will see Guard personnel in hospitals, either as medical or support staff, and will they be in uniform?
Well, first question in terms of timeline, we've actually started a couple missions in a couple hospitals already. At least our staff has gone there and done recons of the hospitals or walkthroughs with the hospitals to determine the best way to do those missions. I can tell you most of it's going to be concentrated in northeastern Ohio right now, because that seems to be where the perfect storm is occurring. You have the Delta variant that's still fully there. 70% of the new cases are Omicron, which is creating another surge. And again, that's where they have significant staffing challenges. So Northeastern Ohio, the Cleveland, Akron, Canton areas where we're going to focus our efforts most, again, under the guidance of Department of Health as directed by Governor DeWine. But that's where we're going to focus right now. The other part of the question is in terms of timeline. As I said, we've had people show up already. We're going to make sure our folks are safe. So we're putting them through 1, 2, 3 days of training, depending on what kinds of roles we anticipate them, and making sure that they've got their HIPAA training, their Privacy Act training, and making sure their CPR is current and those sorts of things. So after they're in processing, we'll get them through that training. I expect to start seeing people show up in the hospitals in large numbers on Thursday. So the goal was to get them in by the 26th, the day after Christmas. I think we're going to exceed that by quite a bit when we have significant numbers showing up in the hospitals on Thursday.
Tony from 13 ABC Toledo. Do we have anyone from 13 ABC News yet?
Hi, can you hear me?
We can hear you now, sir.
Okay, great. Yes, I was just wondering if you had more of a timeline from ODH on when the Guard members may roll out, And then initially last week, when the governor ordered up I think it was 1,050 guard members, they said there were 150 EMTs, 900 who are just doing support services. Have those numbers changed at all?
No, we're still, Tony, those numbers are still the target numbers. We're still targeting 150 medical personnel. That's a plus or minus number, of course. But it'll be approximately 150 folks. And then the 900 for the wraparound services, again, that's still the target. It takes some time to build to that. You know, the in-processing, credentialing at the hospitals, badging, all those things, they take time. We can't just, you know, I wish we could just plop 1,000 folks into the hospitals and start working today, but it's a far more complex operation than that. And especially building the structure so that we have the ability to move folks around. The hospitals that our folks will work in this week will be very different than the hospitals they work in next week. And again, that's going to follow the demand based on how the disease and the stress on the hospital spreads across the state.
Ryan from Spectrum News.
I don't have any questions. Thank you.
Thanks, Ryan. Dan Perlman from Channel 6, or sorry, Channel 4. Apologies.
That's okay, Stephanie. Good afternoon, General Harris. A couple of questions for you. I know you said we will start to see guard members in the hospitals in large numbers on Thursday. Is that the case here in Central Ohio as well? Will we start to see guard members here on Thursday? Also, is the National Guard prepared if more guard members are needed and more are mobilized down the road?
Well, the first question, Central Ohio, we may. Again, the Department of Health and Hospital Association are still doing that analysis. I would expect, quite frankly, the preponderance of the folks go to Northeastern Ohio right now because the crisis is so dire there right now. I think every part of the state's going to get their turn, quite frankly, as I look at the numbers and the spread. But initially, the focus is probably going to be mostly there in Northeastern Ohio. And yes, we do have additional capacity, but I will tell you, we screen every soldier, airman, every airman that comes onto the mission. Again, we're not going to put folks on that aren't vaccinated. We look at potential conflicts with civilian employment, and every one of those cases we look at it a case by case basis. Yes, we do have additional capacity. The question is, how much do we have to balance, you know, this crisis in our hospitals with the workforce shortage across the entire state? Do we pull first responders in who have medical skills? Or do we leave them on the fire department or the sheriff's department where they're currently working? And we do that calculus, kind of that risk reward kind of calculation as with every single individual. And as we determine as we get deeper into this crisis, how deep we want to get into the workforce before we start affecting other employers. Because it does have an impact on every employer. There's not a segment out there of the workforce that's not short-staffed right now. So how critical is that person in their current employment and their current job versus what we would be using them for to pull the hospitals through this crisis?
Bill Reinhardt, WVXU.
My question has been answered. I yield my time and thank you for yours.
Perfect. Thanks, Bill.
Thanks, Bill.
Laura Hancock, Cleveland.com.
Hello. I just have a question about the Cleveland testing site. You had talked a little bit about how this morning, that after the 3 hours, you just start turning people away due to traffic safety in the area. How many guardsmen and airmen are staffing that, or any right now? And you had also said that you were going to relook at the situation there. And I was just wondering what you meant by that. Do you mean possibly opening another test site far away from downtown, or I mean, what do you think is going on?
Well, yes. Right now, I think the number is 8 and 8. We have 8 medical folks, then 8 support people to help them with the administrative and the logistics tasks associated with that site. And by relooking it, I mean the whole gamut. Can we rework the traffic flow so that we're not causing the congestion there? Do we have to look at another facility? That's a great facility, that Walker parking garage, because it happens to have heated spaces for folks who are working there. And we thought it would be optimal, but of course that that law of unintended consequences. We didn't really see the numbers showing up this morning of congestion that we experienced. So when I say relook, it's we may have to go back to the drawing board and relocate. We'd like to keep it in the same vicinity, but everything's on the table, quite frankly, because we certainly don't want it to be a disruption for downtown.
Also, just one last question. Do you anticipate more than 16 people for guardsmen or an airman, or are you going to keep it at 16 right now?
For that particular site, I don't know yet. It'll depend a lot on that assessment. You know, we always do troops to task assessments determining that we think that package is optimal for that facility and what we thought was the throughput. If we go to another facility with greater throughput, we may need more people. If we establish a second facility, we may need more people. So again, that's all on the table right now based on what we decide and how we figure out we need to fix that problem that exists there right now.
Laura Bischoff.
Hey, General, you've mentioned a couple of times that you're not going to send in guardsmen who are not vaccinated. Can you tell me what the vaccination rate is for the 17,000 members of the National Guard?
Well, yes, for our Army National Guard, that's in the vicinity of 53% fully vaccinated. And for our Air National Guard, they're at about 92%. As you know, DOD has a mandate. The mandate ended earlier for the Air National Guard, so their numbers are much higher. That mandate hasn't fully executed yet for the Army National Guard, so those numbers are still climbing. But those are approximate numbers. They're definitely in the ballpark of where we are today.
So is that low vaccination rate on the Army side, is that a limiting factor for you in terms of being able to roll out as many guardsmen as you would want?
Here in the short term, of course, I'd love to have access to all 100% of the folks in the Army Guard. And again, the numbers are coming up. And the question that came up earlier, you know, how deeply can we get into the workforce? How much capacity do we have? Much of that will be determined by, you know, some decisions around vaccinations. Is it safe to put a person with only the first shot who's still waiting to get the second shot into a hospital? Right now, we're not going to do that. Is if a person's had their second shot, we just administer the booster to them. You know, how safe is it to put them in the hospital? All these things we're weighing, but I can tell you the folks that we're putting in right now have both doses and they'll be fully vaccinated for the mission. And it's important. We certainly don't want to cause harm as we try to help these hospitals through this crisis.
Thank you.
Thank you, Laura.
Jatara McGee.
Hi, Major General Harris. Thank you for doing this. I know you had just mentioned sort of the vaccination importance when you're looking at who's going to be going into these hospitals. I'm wondering, though, if you also are encouraging guardsmen to get boosted before they go in, and then also if there's going to be any testing protocol in place to make sure if they do get COVID, especially if they might be asymptomatic, that they're catching it early.
Yes, we are certainly offering the booster. Like, that's not part of the DoD mandate, but we're offering to any soldier who wants, or an airman who wants to take that as during their in processing. And I don't yet have the numbers on how many are taking that, but we do have folks that are taking us up on that. The second part of your question was
testing. Will they be regularly tested?
Yeah, we're still working out what those testing protocols will look like, and that will be driven not only by our requirements, but also the facilities they're working in. And I anticipate that may vary from hospital to hospital, depending on who we're staffing.
So it's safe to say there will be some kind of testing protocols in place. It's just not clear what they're going to look like.
Absolutely.
Okay. Thank you.
Gina Cavallero.
Thanks, Stephanie. Thank you, General Harris. This is Gina Cavallero from Army Magazine. Could you please tell me how many Ohio National Guard soldiers are deployed in the state right now? Are there any deployed outside of the state? And will any Army National Guard soldiers from Ohio be participating or deploying as part of a larger military force that President Biden is expected to announce soon? Thank you.
Well, I'll start with the last question first. I don't know I don't have any idea what President Biden's going to be announcing soon. I can tell you we do have major deployments scheduled. We have both our our 37th Brigade Combat Team will be deploying with a package to the CENTCOM area of responsibility. We have our 371st Sustainment Brigade headquarters, which is a large formation deploying. We have our Air Defense Artillery Brigade headquarters. We're going to be going to Europe for part of the mission command element. So we have some pretty good sized formations and senior commands that'll be leaving the state here all within the next 12 months or so as part of missions around the world. So our global demand requirements continue to press us. We're certainly in a great position. We're the 5th largest National Guard in the country, so we're in a great position to deliver on that. Here deployed in the state, before we started this mission, I think we had about 82, 83 soldiers on orders that were doing various missions around the state, to include going into our senior living facilities and helping with booster shots there. That's part of our mission supporting the Department of Aging. Most of their facilities are covered by contracts with pharmacies, but those senior housing facilities, some of those subsidized housing facilities specifically set aside for our older Ohioans, they needed help with boosters. So we have people on staff that are doing that. And again, with what's in the testing mission and a couple hospitals, plus what we in process yesterday, we probably have about 600 folks on duty already, and we'll continue to phase in more. And that's here for Ohio. And we continue to phase in more to get to those numbers we talked about earlier.
Do you foresee any Ohio National Guard soldiers being deployed to other parts of the United States for any of these COVID missions?
Probably not for COVID. We enjoy what we call interstate assistance compact, or emergency management assistance compact, EMAC compacts, with other states where we agree to share resources for disasters and emergencies. In this case, though, every state is pretty much dealing with the same crisis. That's the challenge of a global pandemic. There is no EMAC from state to state because every state's dealing with their own crises. So I don't anticipate that we will be leaving the state in support of COVID missions, but we do have folks that are deployed down on the southwest border. We have about 170 Ohioans that are deployed CONUS, so inside the continental United States, but they're not doing a COVID mission. They're doing that southwest border mission, supporting customs and border protection.
Thank you.
Mark Gillespie from AP, are you able to ask your question, or would you like me to ask?
Yeah, I can ask. Given the low vaccination percentage for your Army National Guard personnel, how does that affect mission readiness? And is there going to be a requirement that these folks get vaccinated at some point?
You've gotten to the crux of the problem, and this is why there's a DoD mandate in place, is because in order to meet our national security requirements, and frankly, our requirements right here in the homeland, we have to ensure that we get the entire force vaccinated. There's been a lot of debate, and I know that you've seen that some governors have pushed back on the DoD mandate to get our National Guard vaccinated. But the reality is, it's that simple for me. We have to deliver on our national security obligations. And in order to do that, we have to get our forces vaccinated. So the deadline for the Air National Guard has already passed. It was the 2nd of December. The Army National Guard has a deadline of June. I have put a sooner deadline in place, 31 March, for our Army National Guard to get vaccinated. And those numbers are increasing. Our folks are complying, but it's that simple for me. And guardsmen, anybody who's worn a uniform knows this. You get 7 or 8 vaccines just when you join the military to make sure that you're ready for global deployment. If you go to specific theaters, you take a battery of vaccines and antibiotics or whatnot for that particular theater. And this is no different. It's a matter of national security. And all the other noise around this issue, quite frankly, has to become irrelevant for us, because we have to be ready to meet our global obligations.
Is your current mission readiness position imperiled by the lack of vaccines?
I don't think imperiled is the right word. We are certainly in a position to meet all of our global requirements that we know of right now. We're able to generate the force that we need here in the homeland to meet this mission. But It does degrade us. I won't say it's imperiling us, but it degrades our ability to respond with the maximum capability. But there's never been a time, even at the peak of the global war, even at the peak of the COVID, we've had no more than 20 or 30 of our percent of our force that was engaged at any given time. Again, we're blessed to have a large National Guard. So if we were a smaller state dealing with these same numbers, I would say imperiled might be an appropriate word, but it degrades us, but it certainly does not impede my ability to deliver on our missions here at home.
All right, thank you.
Those were all of the questions that I saw on the chat, and we are out of time. Sir, did you want to say any final words?
I want to reiterate what I said earlier about just the quality of the people who comprise the Ohio National Guard. These people are amazing patriots. They didn't flinch when we called them literally the Monday before Christmas, called them to duty the Monday before Christmas. And nobody sitting in that auditorium for the initial in brief is doing what they thought they were going to be doing on that morning. So they've come, their morale is high. They're going to do a variety of tasks. They don't even know where they're going yet. They don't know which hospital they'll be in. They're not sure what they're going to be doing when they get there, but they're leaning forward to get it done. And I couldn't be more proud of them. So to them and to their families and to their employers who lost an employee temporarily on almost no notice, thank you. Thank you. It's because of you. It's because of you that the National Guard can meet its obligations to the governor, to the people of Ohio, and in this case, to these hospitals who desperately need the help. Thank you. And so when someone walks to me and says, thank you for your service, my response, number one, is you're worth it. And number two, thank you for setting the conditions for us to be able to do that.
Thank you, everyone. I appreciate it.
Recording stopped.